And I want to welcome everybody, and we'll get started here in just like a few seconds. If you're having any kind of connection issues, if you have a way to let me know, let me know. And if you wouldn't mind typing into the chat window while we're getting started here, where you're located so we can kind of see where people are joining us from, that would be awesome. I know most of you, but sometimes there's a first name and only a first name or something, and I have more than one. There's more than one Melanie, so I don't know which Melanie is joining us today. So anyway, um, I'll just go ahead and get started then. I want to welcome you all. I'm super excited to have you here today. I was just talking with Michelle and Suzanne about my replacement should be named soon, and you guys will definitely get notified right away when that happens. We've had some really great applicants, I know, and it's been a tough decision. The Health Fund has been doing the interviews. I've not been a part of that. So anyway, I'm looking forward to enjoying my retirement at the end of the year. And I know I will be handing you off to very capable hands when that happens. So again, welcome, and we're recording this so that it can be listened to later. And I want to just get started. We've talked in the past about the difference between High Five and High Five Premier. So I just want to reiterate again that High Five is 5 practices. You can be recognized as a High Five hospital, or you can do all 10 practices and be recognized as a Premier hospital. Currently in our state, we have 10 Premier hospitals, but um, I probably won't be able to lay my hands on that piece of paper really fast, but I was just talking with Katie yesterday, and I looked at all of your re-recognitions from the first of the year, and I added up how many hospitals were doing how many practices, and it was really astounding to me how many of you are doing 8 and 9 practices, that you're right on the cusp of becoming a premier hospital. So I really hope that you continue with our education modules that are online now. That's a really great resource for education, which is the one step that most hospitals still needed help with. So I'm hoping that you're taking advantage of some of that. And judging from the number of classes I've been turning into the State Board of Nursing, I know you are taking advantage of those classes. I can tell you that much real quick here. We launched those classes in June, and there were 18 people plus a few non-RN people that took classes. So if you took 1, 2, and 3, I count that as 3 people taking classes. So June was 18, July was 32, August was 63, September was 190, and drum roll, October was 366 people took classes, or 366 classes were taken for credit in October. So thank you for making those classes a big success. We're glad they're of value to you, and we hope that you'll continue to use those. So you know our 10 practices. I won't belabor that much. But today I wanted to talk a little bit about COVID with you. You know, it seems like it's a very talked about subject, but at the same time, I feel like there is still misinformation out there about it. And as we all know, it's not going away anytime really quickly, like I think I hoped when it first broke out. So I wanted to talk a little bit about the challenges that you're still facing I'm hoping to maybe glean a little bit of information from you as we discuss about what would help you resource-wise going forward with any challenges you're facing, how you can connect with other hospitals here in our state to kind of see what they're doing and work out some of those challenges, and maybe you have something that's worked super well and you want to share that with our group. So that's kind of my hope for today. Um, how are you supporting families after they go home, and how have you that to support those? I also shared these links. I don't know if you can click on them or not, but when Michelle and Suzanne are speaking, I'll copy those into the chat for you. These are some, and they may have it in their talk as well. These are some frequently asked questions documents that came out from KDHE here in Kansas. So I just want to make sure you have access to those. They have them posted in English and Spanish. So I don't know if the reading level is such that you could try and give that to a Spanish patient, but it may help you in some situations. So um, Michelle and Suzanne, I just want to say, have just been my go-to people. If I have a question that I can't answer, I just email Suzanne or Michelle, and they're just so helpful to me and such a great resource. And they're in the trenches that I'm not in. And so they've just been so very helpful. They've also been super encouraging during this whole 2-year journey to get online classes up and running, and very um, very good at telling me that's not good and that is good. And so I appreciate that kind of feedback, because when you're just sitting here working from home, it's really difficult sometimes. So I formally would like to introduce Suzanne Bentley, who is a clinical nurse specialist, and Michelle, who is the at University System main campus or University of Kansas Hospital, how you guys do it exactly, but I'll turn it over to you guys.
Yeah, sometimes I'm not sure either, but I think both of those are right, Gwen.
It's listed both ways on the website.
Yeah. Well, thank you for the lovely introduction, Gwen. And I think we'd say the same thing for you, that you're our go-to and kind of our connection to what's happening in other hospitals throughout the state. Just having the pulse on what's happening by all the resources and communication that you're having with the small hospitals, the large hospitals, everybody. Because I think with this COVID stuff, we've all been kind of learning as we're going and getting comfortable with adapting practices and PPE and everything rapid fire. So we definitely, when Gwen asked if we would throw something together, we said, sure, because why not? But we do want this to be kind of informal and an opportunity to kind of talk about what things you guys are doing in your facility or challenges that you have. So, I mean, certainly we can have discussion at the end, but if there's things you want to jump in and ask about or talk about, for sure, please do. But do you want to say anything else, Suzanne, or?
Well, I still remember when you came in May of or June of 2013, and all the staff said, we have to go to a 2-hour in-service? Really? We have to sit and talk about breastfeeding for 2 hours, and now we have to do all this stuff, and oh my gosh, how far we've come. So
Yes,
still remember
I
all
would
the
agree.
services you did. Oh,
That 2 hours.
We actually
Into 2
we
days.
actually did
yeah.
we actually did that class over 200 times in the state of Kansas,
Oh
Libby and I. So
you were everywhere.
yeah, it was a lot.
Libby. Yeah. Yep.
Okay. I think can you see the slides?
Yes.
Yeah.
Okay.
All right. So we're gonna let you're driving, right? Okay.
Okay, yes.
All right. So I thought we'd just kind of start with a little bit, and this is probably a lot of what everybody already knows, but I think we are seeing that, even though overall the rates of illness are low, pregnant people are at an increased risk. And I think what we kind of found through this past summer with the Delta variant too, maybe even more at risk than what we previously would have thought in like the earlier months and maybe even first year of the pandemic. But of course, those underlying medical conditions. Uh-oh, we lost our slides, didn't we? So, hypertension, diabetes, obesity, some of those different things that are similarly affecting the general population are, of course, affecting women in pregnancy as well. And the infants have, oh, we're losing our slides, aren't we?
No, I'm
Gwen,
getting
can
them
you
back.
see the
Sorry.
slides? Oh, no, that's okay. I really don't even remember what I wrote. I need them.
Yeah.
I think maybe, can you go back one? If you can't, don't worry about it.
There you go.
Did it go?
Yeah. We're right there. So of course, additional underlying health conditions are going to increase chances of getting COVID, but also the severity of illness associated with the disease in those individuals who have COVID. And we are seeing an increase in preterm births. It's so tricky to see. I don't know if we've experienced that at KU, or is it just our normal crazy? I don't even know. It's hard to sort it out, but statistically speaking, increased risk also for other poor pregnancy outcomes such as preeclampsia and cardiomyopathy, coagulopathy. Sorry, I'm saying that wrong. So definitely things that we're seeing here in our facility and being a higher risk place to start out with. So yeah.
So the other thing that comes up is we have ECMO here, and we've had to put a couple of moms on ECMO, and that's heartbreaking. Really, really heartbreaking. That's the last ditch place to go. And I mean, we did have a mom come off and actually go home, but that's not always what happens. So, yeah.
We had and the length of time. I mean, to do ECMO for 2 or 3 weeks, I just didn't even know that was like a thing that you could do ECMO for that long. But this one particular mom was a multip and had breastfed her older 2 children, had to be general anesthesia for the C-section to deliver this baby, and intubated almost immediately after that. And those nurses in the ICU were pumping her for 15 minutes every 3 hours. They were just doing, I mean, of course, the medications that she was being given were not ones that were compatible with giving that milk to this baby. But the dad they had some milk at home from, the previous baby still in the freezer. So it was kind of a cool situation. But I mean, she probably, had a hit to her supply overall, but I mean, you got to hand it to those nurses that had to learn how to use the pump, and they were just in there doing it.
Those ICU nurses are great. They put it on the Cardex and they do it every 3 hours.
Yep. Yeah. So, yeah, but we definitely, maybe only a couple of those kinds of cases, right, where they've been on ECMO, but yeah.
You can go to the next slide. And I think that's just kind of what it says, that, that ICU, they're sicker, and then,
Yeah. And like many other, health outcomes, especially in the perinatal period, we are seeing higher rates of illness and death in the Black and Hispanic population than in other pregnant women, where we're already more at risk. You add COVID to the mix. I think we're just seeing this, increasing amount of disparity in people of color versus the white women tend to have fewer other challenges and it's those social economic inequalities, inequities, and I just linked to this whole section from the CDC because it was just really good summary of that topic, because I think a lot of times people think, oh, is there something biologically? And it's like, no, it's actually not. We do need to dig into this more, so included that link.
Go forward.
And then other kind of more infant focused risks, of course, preterm and everything that goes along with that. They said a possible increase of stillbirth. Of course, we probably have smaller numbers, but enough to say that that's something that's a possibility. Of course, the rare chance that the COVID could be passed vertically, but
Have we seen one of those?
I don't think we have.
Yeah, we've been looking for that to see if that's the case, and I'm not sure we've made that link.
Yeah,
Here
I don't think
anyway.
we have. Yeah. And then after birth, of course, there is that, with prematurity, increased risk that the baby's going to need NICU care, or just seem to have more respiratory challenges a lot of times, where they may be term babies, but they just tend to have a little more respiratory needs. Sometimes those, not a direct admit to the NICU, but struggling a little bit. I feel like we've had a couple of those. And then, of course, the newborn could get the virus, that transmission through droplets and all that. So, yeah. Next slide. So these numbers, and of course, I'm trying to have citations on all of these slides, but I had these really great numbers that were in a summary from in a recent town hall about a week and a half ago, talking about vaccination in particular with the pediatric population and everything that was coming out, with that younger population being able to get vaccinated. And our full-term nursery director, Dr. Whitney Pressler, presented, and I was frantically writing down all these numbers because I thought this is really just to kind of put it in perspective. What are we talking about? So at that time, about a week and a half ago, we had in the United States about 700 pediatric deaths, about 8,000 children experiencing long COVID, which was just like, wow, right? We think about this being something that adults are dealing with more, and yeah, of course they probably are, but so much that we have to follow with these children, 8,000 children that are experiencing some of these same kind of symptoms. And then the MISC that we were hearing a lot about earlier on too, that multi-system inflammatory syndrome and what that's looking like. So good number of those. And about a third of these children have no other pre-existing conditions. So, basically her pitch was, yes, do get vaccinated.
Get your
do
kiddos
get
vaccinated.
your kiddos vaccinated.
Yeah. And she did say that every single one of the pediatricians she works with, all of them have had their children vaccinated. The appointments were gone in within 2 hours because everybody was just rushing to get those 5 to 11-year-olds vaccinated. So yeah. Yep.
I saw a statistic just this morning that they said approximately 10% of children in that 5 to 12 age group are now vaccinated. 10%. That's a lot.
Yeah.
Yeah. Yep. Go ahead to the next one. Okay, so when we started this whole event, everybody wanted to know how many of our mothers were COVID positive, and we had no way to to gather this. So I worked with one of our business intelligence folks to put together a report. So at the time when a mother comes in, was she positive for COVID within 10 days of her delivery date? And you can see that these numbers kind of mirrored all of the surges that we've had. And thank goodness October, we are down to just one case of of a mother who was considered COVID positive when she came in the door. Now, we might have had a few extra because if they got their test at an outside source, so if they were from Fort Riley or Topeka and that outside resulted externally, I didn't capture those few people, but so this just kind of shows us our rate of those moms who had who were positive at the time of admission. And the next slide shows at the time of admission, then we look backwards to say, have they ever been positive anytime during their pregnancy? And you can see the amount of pregnant women that were actually positive during their pregnancy. So when, we'll talk about what we do here to kind of track and care for our mothers, but our numbers are dropping, thank goodness. And I know our obstetricians and our pediatricians are doing a daily webcast in the mornings. I don't know if you guys ever tune in. It's the University of Kansas Health System Facebook live video at 8 o'clock every morning. They bring on experts from OBGYN, infectious disease, pediatrics, and they talk about the literature as it changes moment to moment. So when you see people talking about this is exactly what we know, we don't know this, but we do know that, and you hear them, I trust what they're telling me. I know these people. I know what's going on. And so I'm like, okay, I feel so much more relieved to know that they're working really, really hard to give us the best possible information that they can. So, and next slide. So this will just, I know it's a long list, but essentially what happens is if a mom's going in for a scheduled procedure, and I worked the COVID hotline the last year during COVID. So I was on the hotlines 2 and 3 days a week. And I was so relieved when I first got to start doing vaccines because in one hand, people are distraught on the phone and scared that they might die. And the next I could go and give them their immunization and my heart felt 100% lighter. But so moms would schedule their COVID test 2 to 3 days before they came in for scheduled. If not, and they come in labor, we test them as soon as they hit the door. They are then considered a person under investigation until that result comes back, which is about 4 to 8 hours. Initially, it was taking longer, but we can get those tests back really soon. And so they come in and we put a red dot on the door until we get the result. And then there's a green dot that says they are negative, they do not have COVID. So they can have 2 visitors come with them. And the visitor that's with them has to stay in the room until we absolutely know that that COVID test is negative. Visitors and moms are encouraged to wear masks all the time in the room. They don't walk in the halls. Support people can be in there too. We screen them. We ask them if they have symptoms, but they are not tested for COVID at this time. Moms are asked to wear masks. All of our staff put on N95s for the time of delivery. We think those times where you've got aerosolizing procedures could be pushing more of the virus into the air. So the masks are worn just at the time for delivery and an hour or so after, and then we just use the regular kinds of precautions that we would if she's positive.
If they're positive.
Yeah, if they're positive. So a lot of times moms, they may be asymptomatic but positive, or they could have just some minor symptoms. Occasionally mom will come in and she'll have some symptoms and then get worse and have to go to the ICU. If she's really, really sick when she comes in, we may be delivering baby up in the ICU. And that's happened a couple of times, but that's not the norm for sure.
But N95s for all care of COVID positive moms. Initially it was just like the level 1s, like these lovely things that we're modeling today. But if you're going in a room where it's confirmed COVID, then it's a 95, even if it's not an aerosol generating procedure or pushing hairs before you.
And eye covering, those 2 things. Everybody does that.
Yep.
All right, so breastfeeding is encouraged. Those antibodies are passed from mom's milk to the baby, mom and baby room in. If mom and baby are stable and mom is not ill, support person is encouraged to care for the baby. If mom's too sick to care for the baby and has to go to the ICU, she might pop up there for a day or 2 and then come back down to room with her baby. She pumps no matter what, even if she is in the ICU. And sometimes we have to modify that just depending on the circumstances. So
maybe we can talk a little bit about the whole isolate for baby versus not.
Oh,
you got it.
Yeah.
Hey,
go to the next slide. We just went over this at our last staff meeting.
You're so on it.
Just as a reminder. So we do kind of ask that mom have a little bit of distance to baby. So we have her do hand hygiene, wear her mask. She definitely can breastfeed the baby, but then we kind of offer her the option of having the baby in the isolate 6 feet away and having that support person care for the baby just to kind of limit that exposure, if she's positive. But then what happens, we turn around and mom goes home in a day, right? And then who's there to help her kind of do that? So we do kind of recommend a little bit of distance for a bit of time. In the hospital. Some mothers are like, nope, no way. I really want my baby closer to me. And some are really, it's a temporary kind of a thing as they get a little bit further down the road. All right, so next one.
All right, so we just thought we'd pull together a few different recent studies that have come out, and it just, I'm sure you guys are following all of this too. It seems like every week there's something new and interesting, and so we thought we'd highlight a couple things that had come out in the last few weeks to a month or so. So just looking at, breastfeeding in particular and its role in supporting the reduced risk of COVID. I think what, of course, we know from studying the breast milk itself that mothers who have a history of COVID infection or COVID-19 vaccination are generating antibodies in their breast milk. But of course, then we think, how much does that take? And I'm sure you've had moms ask that same question. Now, how much breastfeeding do I have to do to keep my baby from getting COVID and this kind of stuff? Maybe the ones that are not quite so on board about it. And, these are all things that, of course, we still can't really answer, but so many different variables at play. And of course, we know that breast milk is a host for all kinds of other, immune boosting things, but also reducing and anti-inflammatory, kind of activity, as well as like immune regulating and programming the baby's immune system and all of that. So you can go to the next slide. It was too much to put on one. So researchers in Spain, they were looking at 691 admissions in 13 different pediatric emergency departments. So these infants coming in, positive for SARS-CoV-2 via the PCR, and they were looking at method of feeding. And we are seeing that there was a reduction in rate when a baby was ever breastfed. And so, of course, it doesn't necessarily say cause and effect, but it was a pretty stark difference that they had noted, in the patient populations. Of course, anytime you hear that anti-breastfeeding, that can be kind of, right? We went to breast one time, or we're mostly breastfeeding, or exclusively breastfeeding. Obviously, those are very different things. They were collecting data on a lot of different things, but it was, enough that, suggested that there is some protection there. What else? One more slide. Yep. This was another study really looking at not just the antibodies in breast milk, but also looking at what was happening in the infant's saliva. So this was in Rome, and they were looking at the immune response at 2 days of life and at 2 months of life. So they were looking at 28 pregnant women, so still pretty small, of course, but who tested positive in late pregnancy. So pretty recent study, this data set from November 2020 to May of 2021. And they were looking at the infant saliva, and they were finding that during that first 2 months of life, we had a significantly higher spike specific salivary IgA antibody levels compared with the formula-fed infants. So suggesting that maternal protection is more than that passive immunity. It's actually a pretty complex something that's happening through that provision of breast milk and breastfeeding to activate the development of the immune system. So something I think that we've seen with other things, but it's nice to see that there's protection with COVID. And that one's super fresh. Yeah, November 21. Next slide. Fun one.
I think this is a fun one.
No, not yet. Next one.
Okay. Okay. So really, the bottom line here from all the experts are we recommend vaccination during pregnancy and during lactation. There's a new study that shows that women who were pregnant or lactating are slower to mount a response after that first dose, but their dose is almost normal with the second one. So what they're suggesting is that women get immunized during pregnancy and then boosted a little bit later on. And they also found a difference because the maternal immune system has to dampen down so that it doesn't recognize baby as foreign. So they think that might play a role in this blunted response initially, but then those things do get to normal after that. So yeah, and they also, part of the study also looked at female babies and male babies, and there was a difference in how a woman mounted her immune response depending on the gender of the baby she was carrying, which I found fascinating, very interesting. Okay, so next one. So this is a fun one. This was actually on the Breastfeeding University, And it was in the fall of 2020, the Dutch people, they did some research, the university did, looking at breast milk, and they found antibodies in it. So their proposal was, this is before vaccines were really readily rolling out, they were going to take maternal milk and they were going to pasteurize it and make ice cream out of it and then move it into the nursing homes with the elderly population who weren't protected in any other way. And so they were going through IRB and getting everything ready. And they said they were testing flavors and they thought pear seems to be the most popular one. I went back in to look to see if they actually got around to doing this, and I couldn't really tell if it got implemented or if immunizations took over and they did that. They were also freezing mom's breast milk in ice cube trays and then popping ice cubes in their mouth. So just to say, the initiative that people will take to keep people safe is just phenomenally wonderful. And breast milk is wonderful stuff. So.
And only in the Netherlands.
I
I just
know.
love it. I mean, that would be, but who wouldn't rather eat ice cream than get a shot anyway, right? I'm sure the shots came around and they went that route, but
Well, they found that moms sustained those antibodies for up to 6 months, and those antibodies were even present after the holder's pasteurization that they would use. So, yeah. Yeah.
all right. Is that it? Da-da-da. Yeah, we left a fun one.
That's it. So rather than me trying to fumble to get back to my slides, I'm just going to say thank you very much and leave it at that. But I want to open it up for discussion. Does anybody on the call just unmute yourself and ask your questions of Michelle and Suzanne? Maybe you've done something at your hospital that worked really well. I'm also interested in what you're doing as far as prenatal education kind of things. So that might be something you could talk about and share. Before I do that, I'll just interject my own personal experience with a lactating mother that was immunized. My daughter works at one of the hospitals here in Wichita, and she called me all in a panic because, you know, when once immunizations rolled out, they got them like that week. Like there was no time to sit on her hiney and make a decision. And she was like, two of my friends are telling me not to get immunized because I'm breastfeeding and I don't know what to do. And I was like, go get that shot. I said, don't you dare wait even a minute. Go get that shot. So she did, and it was really crazy because she was working obviously and pumping and could see her milk. And so it was noticeably more yellow for like a day.
Oh.
And then it kind of, the color kind of regressed back to the normal looking color. Then when she got her booster, her second shot, it wasn't as pronounced, but still she could tell a little bit of a difference. But I was like, that really is golden stuff right now. And so she, of course, fed her daughter a lot during that time period. And we're hopeful that her daughter got immunized at the same time. So
Cool.
Yeah.
I had heard that something similar, either that it looked more golden or people saying that it looked darker or something, which maybe that's what they meant. More sounds like you're describing more like colostral looking, but
yeah.
pretty interesting.
Yeah. She froze one of her bags of milk and it did. It really looked like colostrum in a way. So it was really weird. She's pregnant now and planning to get her booster after the baby comes. So we'll see if she can tell a difference that time too.
Huh.
Anybody have anything to interject?
Well, I can tell you what we had to pivot pretty quickly with COVID, and there were some online resources for classes that we rolled out, but we wanted to start teaching again. So we went to Zoom classes. So it's a free 2-hour breastfeeding Zoom class and a free 3-hour, 3.5 hour for childbirth classes. And so the lactation consultants, I think they're having a lot of fun teaching.
Yeah.
Before it was just 1 or 2 people, and now we've got almost like 4 or 5 people like really wanting to teach because they have a lot of fun. So they're teaching, and then we have one person teaching and one monitoring the chat box. And we might have 25 to 28 people in class.
Wow.
They've gotten Zoom bombed twice though. so so you have to kind of figure out really quick, like how do I shut this down and get it back up and get everyone back on? And so
Oh, wow.
they just handled it beautifully. They don't do that to our childbirth class. I think the breastfeeding class kind of puts people into a, hey, let's see if we can get in there. I don't know.
Nobody wants to see a baby being born, but
It's not like we're showing
come on,
breast
I
here. What's
know.
the deal?
And actually, I think we've
Perverts.
got it under wraps with that. I mean,
Yeah, we do.
I mean, with yeah, I mean,
We
I think
added
it was
some.
just kind of adding a few other little steps, and that person that's monitoring the chat box is letting people into the room or whatever.
Yeah.
But it's been kind of nice too because I mean, don't you think our numbers are higher
Oh,
than the
yeah.
because
Yeah.
you could only fit however many in that room in Heart Center, like
25.
25,
Yeah.
and that's a couple, right, would be, so that could be only 12 or 13 couples.
Mhm.
Whereas if you've got 25 people signed up for a Zoom class, I mean, it's the moms mostly, and then the dads are often sitting there. So,
Yeah.
but the chat box thing has been cool too because, sometimes you might want to ask something just specifically to the lactation consultant and not to the whole group.
class,
And
yeah.
some of that, they're very busy often
Yeah.
in the chat box. So
Yeah.
Huh.
do it from
That's
home, and that's
awesome.
nice.
And then we send them a PowerPoint, and then we also send them links to other places so they have additional resources to work with and play with
Yeah.
as well.
Mhm.
Yeah.
Well, I would say for me, like I live on the outskirts of Wichita. I'm about 7 miles from civilization or from the city limits of Wichita. And so for me to drive to the hospital here, if I was to do classes, takes me 35, 40 minutes to get there. So if I could join something right from my own house,
Oh,
that
yeah.
saves me over an hour of commute time. So I think especially like in Kansas City, I've got to feel like that's some of it also. Like I'd be much more willing to join a class by Zoom because I wouldn't have to drive.
Yeah.
Parking for us is huge too. Parking
Oh
and
yeah,
walking.
I forgot about parking
It was
there.
terrible. So for them, that's like great.
Yeah.
Yeah. Well, even our Wichita Area Coalition is still meeting by Zoom and probably will for the foreseeable future because it's just we get many more people involved in our coalition because they're all not having to drive, not having to drop everything.
Yeah. So yeah, I'm curious. I don't know if you guys could
They're
jump in the
teaching.
chat. Like, I'm curious how many people are doing things in person again, like support groups and classes.
I know our WIC is not.
Yeah.
I don't think they've had a class going for a while now, so.
See if anybody from learning.
I know that Hayes is doing classes virtually.
So Jacqueline is in McPherson doing childbirth classes in person.
Yeah.
They only do them 4 times a year. How are you doing, Melanie, and Tony? Melanie is in Manhattan. New Birth Company are doing virtual and in person.
Yeah. Good too.
Is Sandra, is this Sandra Redvay from Riley, from Irwin Army? I'm guessing. Melanie Ramsey says all of their classes are online offered through Wichita. Oh, so Ascension Via Christi Manhattan are using Ascension Via Christi from Wichita?
Oh,
Wow, that's something I had never thought about. Huh.
yeah.
Brenda Blankenship is in Pratt. We do childbirth classes in person here. We have them every other month. Our attendance is small, so social distancing is easy.
Yeah.
That's good.
30 couples is just not, it just doesn't work very well.
Mm-hmm.
Way too many.
Oh, Tony Carter is in Chanute. She's doing in-person private classes. Takes a lot of time, but really cool because I answer individual questions and can tweak it as we go.
It's cool.
That's great. So I know Ascension Via Christi here in Wichita is doing a support group now virtually, and I'm pretty sure Wesley is doing the same thing. Is anybody else doing a support group? Jill says we're still online here with the Enjoy classes,
Yeah.
working on virtual as well.
I would love to
Okay.
know how the support group would go. I think we should try that. We should try that.
I guess I
You
really,
can't weigh a baby though.
you can't, and you can't really, I don't know. I guess I just haven't been real excited about it, I have to say.
So New Birth Company said they're doing a virtual support group monthly.
And that's, I think, pretty much all LH League in this area is doing virtual.
Yeah.
So,
Chanute says we see patients back for help after discharge or refer to Stephanie Henry is in the health department there in Chanute.
Our lactation clinic is in person right now.
yeah.
So
I know Ascension Via Christi here in Wichita, I'm sure they would share with you how they're doing it. I think it's working well for them. To me, it sounds almost like what you're talking about. It's almost like a La Leche League meeting. Like the moms are sharing with each other, but they're not offering advice, and that it's a support group for the parents.
peer support group, yeah.
Yeah. I would be curious if that, I would think just facilitating in-person groups, when you're all in the same room and when you get to know the moms and they get to know each other, it's real easy to.
Very different.
Suzanne, maybe you can share your experience with blah, blah, blah. And, you can get this all going. I wonder if that's hard to do
On Zoom.
Yeah.
Yeah.
Or maybe that's just me thinking that I don't want to do it. But I would love to get in person going. I just want this to all be over so we can get back to normal. But
Me too.
yeah.
So Manhattan, we're not doing support group walk-in clinic, but she can schedule individual outpatient consults. So that sounds like about what everybody's doing as far as postpartum. So what else? Does anybody have questions for Michelle or Suzanne? They did a really good job. I'm going to try.
I do not have all the answers either.
No.
I'm going to try and share those links again. When I tried to do that before is when you lost the slides, so I stopped.
Oh, yeah, I'm real eager to see those handouts. I think we kind of,
Well, don't they just mirror the CDC handouts?
do they probably? I haven't looked.
Yes.
Mirrors the CDC.
But if it speaks a little bit more, we're clicking on it right now. Oh, external site. That's okay. Oh, 18 pages. Oh,
Yeah, recently updated.
yeah.
Yeah.
It does.
Yeah, not all of it is updated, but there's certain parts that they've dated that have the
got to other
updates.
articles too. So
Yeah.
yeah. That's good. Good resources.
So, and then there's one other thing I want to share before we leave. This isn't specific to pregnant women, but I found this on, I don't even know what this stands for, ASTHO, Association of State and Territorial Health Officials. So this is their document on comparison of the vaccine, which I found kind of interesting. I haven't given the vaccine. Well, I did once as a volunteer, but I hadn't like researched that much about the different doses and all that. So it's just kind of an FYI on the vaccine itself. So I just thought I'd throw that out there.
Yeah.
So, okay. I also want to make sure everybody knows, and I should have looked the link up for this. I don't know if I can look it up really fast. the KBC has been compiling all of their information and documents and articles on COVID on one page. So if you go to the KBC website, you can also find a lot of documents there on COVID. If you have a specific question, it might be up there. So just be sure and check that out also.
Yep,
Okay.
good stuff.
Well, if there's no more questions, I want to again thank Michelle and Suzanne, and thank you for your attendance today. It makes me happy that you're all still interested and learning a lot about this crazy couple years we've had so far, and our social isolation or whatever we want to call it. I went to see somebody the other day and we were both wearing masks, and then I saw a picture of him later and he has a whole beard and I never saw it. He didn't look like that when I saw him. Anyway, it was kind of funny. I thought, how much are we missing by not seeing this part of their face? Yeah. So anyway,
Are all the new hires. Everybody was hired in the last, 18 months. We've met them seeing this much only, so it is.
yeah, it's very weird. So, all right. Well, thank you everybody for attending. I appreciate it very much, and we'll talk soon.
Bye-bye.
Bye.